That twice now. Welcome to the last session of Writing Week and the second session focusing on our non-nursing and medicine OET candidates. So just as a reminder, if you are joining tonight as a nurse or a doctor, we had a session for nursing on Tuesday and a session for medicine on Wednesday. So you might want to check out the recordings of those sessions, which are now on our Facebook page. Today, the plan is for me to pick up where I finished yesterday, really. And I'm planning to talk through the dietitian, occupational therapy, optometry, radiography, speech pathology, and vet sample answers. So if you're one of those professions and you haven't yet seen the new sample test for your profession, then the link to it is at the bottom of the screen. You can download this from the OET website now or after the session as you prefer. If you are a different profession to those 6 that I've just mentioned, even if I'm not directly covering your profession today, there is still some general advice I'm going to share that is helpful for your preparation. So you're very welcome to stay around and listen in, but it is those 6 professions that I'm really focusing on during the session. I'm also going to pick out a few letters that have been submitted by candidates for those professions, and I'll comment on those towards the end of the session. So let's get started. In today's session, I'm going to share the sample answer for 6 professions, and I'll talk them through for everyone to learn how to use a sample answer after you've written your own letter particularly, as well as how to make sure your letter demonstrates the highest level possible for the 6 assessment criteria. So what I'd like you to do, I'm going to ask you, which I've done every day this week, is just to find out how many of you joining the session have already completed your own letter for sample test 4, which is now available. And also perhaps in the question box to let me know what your profession is. So tell me what professions we've got joining us tonight. Just while I'm giving you a minute or two to answer those 2 questions I've just asked, and at the same time I'm uploading the sample answers that I'm going to talk about tonight. So it just gives me a minute to do that. So you can download these from the session, or as I said, I will be showing these on the screen. So it's up to you if you want to have a look. And just to let you know as well that all the sample answers now for all 12 professions are available from our website. So if you would like to go and find the one for your profession, then please go ahead. It is now available on our website. Sorry, just having trouble with the last handout that I'm trying to upload. There we go. That's it, great. So let's have a quick look in the question box to see which professions we've got joining us tonight. Okay, so what have we got? Well, a lot of people have questions. Great, so we've got a radiographer, got a dentist, speech pathologist, and then a few doctors and nurses. So that's fine. As I've mentioned, you're very welcome to stay and join the session. There should be some useful content for you as well. But just to let you know that I won't be focusing on medicine and nursing tonight. It's the turn of our other professions. And checking the poll question, about 50-50 tonight. So some of you have written your own sample answer, but some of you have written or you're waiting perhaps to hear this session before you have a go at your own. So that's fine as well. All right, well, let's get on to the session. So I'll close off the poll and we can get started. All right, so I'm going to start off with dietetics. So here is the sample answer for dietetics. And one thing you'll notice straight away, whatever your profession is how many paragraphs have been included in the body of the letter for the sample answer. And one of the things that you might be asking is what happens if you have a different number of paragraphs to the sample answer? Is that a problem? And the answer is not necessarily. We'll come back to that a bit later on in the session about what to do if your letter is different to the sample answer. So the three things that I want to focus on for each of the professions, and I've done this for every profession so far this week. So with the dietitian's sample answer is to look at whether the reader can get a clear picture of the current situation from the way that the letter has been organised. And to do that, I pick out, and I'm highlighting on the screen now, the opening phrase for each paragraph, which should give me enough information to understand how the writer has organised the letter. And you can do this for any profession sample answer as well as your own letters as well. So these phrases that I've highlighted tell me that after introducing the reason for writing, the writer has focused on the patient's current diet, the recommendations that they have for the patient's diet, their exercise, and the next steps that they're recommending for the patient. And if we look at the paragraphs in a little bit more detail, we can see that paragraph 1 covers the patient's medical situation. Paragraph 2 includes the writer's assessment of the patient's current diet. Paragraph 3 includes details about the food and drink diet changes that have been discussed with the patient. Paragraph 4 is the type of exercise the patient does and the benefits of this. Then paragraph 5 is the writer's concern about the patient's non-compliance or potential non-compliance with their medication and when the next review should be. And the reason to pick out all of these details, understand what is included as the sample answer, is then you can go to the case notes, which is what we're going to do now, and check which information has been included and at the same time which information has been omitted, because you want to make sure with your letter as well as the sample answer that the information included is everything that the reader needs to continue care. And at the same time, any information that has been omitted is correctly omitted and doesn't mean that details the reader would need to know have been omitted. So you can see here on the screen the information that has been included in the letter, but the first thing that you should check is why we're writing. So here, the writing task information tells us that we're writing a letter to Dr. Trevor Lowe with your assessment and recommendations. So checking why we're writing, and then secondly, your role in the patient's care, which here is that you've been referred by the patient's doctor to complete some assessment of diet and management following an increase in LDL and low vitamin D levels. So those two pieces of information are important to check first, and then to look at what has been included and what has been omitted. So if we think about it in reference to the sample answer that we've just looked at, some of these details on the top left side have been omitted because the reader already knows this patient, so social and medical background are unnecessary to include. In a similar way, the reader knows the results and the patient's medication, so that they are omitted, with just a mention of the two results significant to the dietitian's input being included in paragraph 1. And on the right-hand side, the writer has summarised the patient's diet into what needs to be improved in paragraphs 2 and 3. So rather than doing before and after, they've actually just focused on what has been agreed on, what has been recommended, and that sort of summarises it much more efficiently and effectively for the reader. And finally, exercise and the writer's concerns are mentioned in paragraphs 4 and 5, coming from the bottom of the letter. So moving on to occupational therapy now, I'm going to repeat that same process. So checking the first phrases that are included for each paragraph in the letter to see whether we can get a clear sense of the contents from just that initial first phrase. So we can see that the first phrase tells me that the paragraph focuses on the reason for writing. Then we have the OT assessment, then the request for a new bed, and finally, as usual, the next steps. And remember, when we come to looking at these introductory phrases, of course, the whole paragraph needs to be clear, but the important thing to remember is to put the key details at the front of the paragraph, so they're not hidden by less important information. And so that's why I'm focusing particularly on these introductory phrases for each paragraph. Have they put the most important detail at the front of the paragraph? So looking at the paragraphs in detail, paragraph 1 covers the patient's condition and a request of the reader. Paragraph 2, the specific findings from the OT assessment and the patient's medication needs. Paragraph 3 covers the request and benefits of a new bed. And paragraph 4 is the writer's plan and a specific request of the reader to support the funding application. So let's now look at that against the case notes. And first of all, why are we writing? So we're writing a letter to the patient's local GP, providing him with an update from your assessment and requesting support for a funding application for the new bed. And your role in the patient's care is to complete a home assessment based on the patient's progressing needs. So you can see in this set of case notes, there's a lot of blank information. So we really want to check very carefully that all the detail that is needed in the letter has been included and the irrelevant detail has been correctly omitted because there's such a lot of blank information. So let's have a look. Again, in this set of case notes, the occupational therapy set of case notes, the reader is the patient's doctor, so they know all of this history. Plus, it's not relevant to the reason for writing, which is specifically to recommend and request support to purchase a new bed for this patient. On the right-hand side, most of the content is highlighted and is included in the letter. So details about the bed and the wife's request for it are covered in paragraph 4. And then details from the occupational assessments which support the reason for writing, which is the new bed, are included in paragraph 2. Let's have a look now at the optometry task. So again, the first phrase from each paragraph is highlighted here on the screen, and this tells us that the patient, that the writer has explained the reason for writing first. You'll hear that this is, I'm repeating this every time, and that goes back to our point that to cover the purpose criteria, one of the assessment criteria, adequately, and we'll come on to those assessment criteria a little bit later, it's important that you explain right from the beginning the reason for writing. And so it's not a surprise, or it shouldn't be a surprise to you, that the first paragraph is always going to explain the reason for writing the letter. But the second phrase tells us about the writer's concerns. Then the results from today's assessment, the conclusion that the writer has reached as a result of those results, and the next steps, which again I'm repeating is the way that all of the letters are ending. And in detail, the first paragraph covers the writer's diagnosis. The second paragraph, which are the writer's concerns, provide a link between the patient's medical situation and the writer's diagnosis, as well as providing the patient's family history, which is significant to this situation. Paragraph 3 covers specific results, and they're provided as measurements from today's tests, while paragraph 4 contains the main finding as well as the inclusion of the results for the reader. And I'll come back to that in a second when we look at the case notes. And finally, paragraph 5 is a specific request to the reader, including the treatment and the offer to co-manage this patient. So if we compare that now to the optometry case notes, and again, looking at our reason for writing provided in the writing task. So we're writing a letter of referral to an ophthalmologist to confirm your diagnosis and management of the patient. And our role in the patient's care is that this patient is a regular client of ours and he's visiting for a regular checkup. Now, again, there's quite a lot of content which isn't included in the letter, which is left blank on these case notes. So it's good to check whether you have included all of the relevant detail for that. So we can see that on the left-hand side, details which are irrelevant to the reason for writing have been omitted, with only details linked to ocular hypertension included in paragraphs 2 and 3. Test results, and there's a lot of test results included, but test results to support the writer's diagnosis have been included in paragraphs 3 and 4. And then the reason for writing is included in paragraphs 1 or 5, and the sharing of results, which I picked up on, is included in paragraph 4. So often this is a common question that I'm asked by a number of professions about whether you should include the test results are attached to this letter. And generally our advice is not to do this, but if the results are needed by the reader to continue care for the patient, that you should include them directly into the letter. But here in this set of case notes, it's actually part of the task. It says to attach photocopies of visual field results and prescription information with the letter. And that's why in this sample answer, it has been mentioned that those details have been attached to the letter, and it's correct to do in that particular situation. Moving on to radiography. Now, radiography letters are a little bit different to some of our other professions. They're often responding, as in this case, to some kind of complaint that has been made against the radiography department. And we can see, again, with the highlighted phrases at the start, that the structure of this letter is to begin with the reason for writing, then stage 1 of the situation, followed by stage 2, so how the situation developed during the patient's time in the radiology department. And then finally, details covering the patient's appointment when it did take place. And if we look at the detail of these paragraphs, paragraph 1 is an explanation of the reason for writing, followed by paragraph 2, the reason that the patient needed an X-ray in the first place, the cause of the delay and how this was communicated to the patient. Paragraph 3 then covers the patient's request and the explanation provided to the patient by the writer in this case, as well as the cause for further delay. And then finally, paragraph 4 covers the actual appointment, the reason for the cancellation and the patient's reaction to that cancellation. So let's look at that against the case notes. Once again, we've got a big section of case notes which have no highlight on them at all. So let's look at the reason for writing and we can understand why that could be the case. So we're writing a letter to the head of radiography explaining the events that led to Mrs. Long's delay, rescheduling and cancellation. And our role in the patient's care, it mentions that you are a radiographer working in the outpatient department, and a complaint has been received from one of your patients recently about the amount of time that she was waiting, with some detail of the complaint that the patient had made and that you have been asked to provide an explanation. So with that in mind, we can understand that this information on the left-hand side, which covers the patient's first X-ray, is unnecessary to be included because any relevant information is repeated in document 2, which covers their second presentation for an X-ray. And so all of that in document 1 can be omitted. So with document 2, only the type and reason for the procedure is necessary to include from here. The remaining information all comes from the right-hand side. So details specific to the patient's delay and the delay in their procedure have been included in paragraphs 2 and 3, but the other details have been omitted. So for example, things like the second patient offering to wait a bit longer because they can see the first patient is unwell, those sorts of details are not relevant to the patients that you're writing about, their frustration and their delay. So don't need to be included in your letter. Moving on to speech pathology, and again, having a look at the first phrase from each paragraph, we can see that the order of the writing this time is reason for writing, assessment completed of the patient, eating assessment as well, and then recommendations followed by next steps. And in more detail, in paragraph 1, the patient's age, their condition, and the fact that they're relocating have been included. Paragraph 2 covers results from today's speech assessment, as well as the mother's report. Paragraph 3 covers how the patient eats and a result of eating trials that were conducted as part of the assessment. Paragraph 4 provides specific recommendations for staff regarding the patient's eating, types of food they can eat, etc. And finally, paragraph 5 covers the need for and when to have a review for this patient. So looking at the sample case notes for this task, and again, looking at our reason for writing, we're writing a letter to another speech pathologist who's going to attend the patient at the new residential unit that they are relocating to. And you are to provide information about your assessment, results, and recommendations. So that gives us very clear action points of what to cover in the letter. And from the notes section, your role in the patient's care, you are providing assessment for this patient as a speech pathologist because she is about to be moved from her family home to a residential unit. So looking at which information has been included, so details related to the relocation and the condition have been included as the reason for writing, but the rest of the details can be omitted. There's quite a lot of detail from this left-hand side at the bottom, which covers the assessment of the patient's speech, as well as their eating assessment, and that's all been included in paragraphs 2 and 3. But as changes are going to be made to meals, we find out later on in the case notes, the current eating pattern has been omitted because it's now irrelevant to how the staff are going to be recommended to look after the patient while she eats. Likewise, on the right-hand side, the choking episode which led to this need for the patient to be relocated to a residential unit is not the main reason for writing. It's mentioned in passing, but all of the detail surrounding that choking incident don't need to be omitted in the letter. Then specific details of the recommendations are included in paragraph 4, and when to review the patient are included in paragraph 5. And that brings us finally to vets, which obviously is different for a number of reasons, the main one being that all of the patients for vets are animals, and that leads to some differences about the RE line, for example, and obviously needing to mention the owner in many cases during the letter. So looking at the phrases that have been highlighted, we can see that this letter starts off with the reason for writing, the cat's medical history, the writer's diagnosis, and again, finally, the next steps for the cat. And paragraph 1 in more detail includes the cat's age, medical condition, and request for a second opinion and why that has been requested. Paragraph 2 covers the symptoms the cat had, the treatment and progress in the 2 visits, as well as additional symptoms that had developed by the 2nd visit. Paragraph 3 includes the blood test results and the writer's diagnosis. And finally, paragraph 4 includes the medication that has been prescribed and the information provided to the owner. So comparing this with the case notes, we can see that the reason for writing is to refer the cat and the owner to a veterinary specialist to confirm your diagnosis, and that your role in this cat's care is that you annually see the cat for their vaccination. So this cat is a regular patient of yours. Looking at which details have been included and omitted, we can see that on the left-hand side, key details about the cat have been included in paragraph 1, but other details have been omitted because either they're covered later in the case notes or they're not relevant to this current situation. In a similar way, on the left-hand side at the bottom of the page, only details which are linked to the current diagnosis have been included in paragraph 2, but the rest can be omitted because they're not important to the current situation and why you're writing to this specialist. Again, details which are linked to the diagnosis have been included in paragraph 3, the results that are relevant to that diagnosis, but the other details from the 2nd visit can be omitted. And finally, the specific advice given to the owner and the treatment have been included in paragraph 4. So now I've gone through each of the 6 sample tasks for the different professions. I want to talk a little bit about what to do with the sample answer after you've looked at it and what to do with your own letter as well. So one of the things that you really want to do is to check how well your letter, and you can do this for the sample answer as well, how well your letter evidences the assessment criteria. And if this isn't a document that you've seen before, you might want to make sure that you have a copy of it downloaded or saved as a favorite in your internet browser so that you can frequently refer to it. The link to where you can find this document is provided at the top of the slides. These assessment descriptors tell us what the assessor is looking for when they're grading your writing. And our advice is always to aim for the highest level, even though for most of you, you won't need to achieve this highest level to get the grade that you want. Now, with speech pathology, they are required to get an A grade in writing. But even an A grade can have some errors in it. It doesn't have to be 100% perfect. And you can see that from the language used in that top band of the assessment descriptors. So our advice, as I said, is to aim for the top. It's better to do that and aim to work on your skills to get to that level rather than aiming at the minimum that you feel that you need to get the grade that you want. By aiming at the top, if you then fall a little bit short, you should still be confident to get the grade that you want when it comes to your test day and your result. So let's look at those assessment criteria in turn, and we're going to look at it using the occupational therapy sample answer. So the first assessment criteria is purpose, and this is testing whether the letter reason for writing is immediately apparent and sufficiently expanded. And so we can see from this example that the first paragraph includes a clear reason for writing, that the writer is providing an update to the patient's doctor, and they're making a request which is followed up on in the last paragraph. So it's sufficiently expanding that reason for writing, which is the second part of the purpose criteria. The second criteria is content, and this is checking whether what is needed to continue care and accurately represent the history have been provided in the letter. So we can see here that details of the patient's current limitations and the benefit of the new bed have been recorded accurately. The third assessment criteria is conciseness and clarity, and this is addressing what is needed to continue care by summarising it effectively and presenting it clearly. So the need for a new bed has been neatly reduced into one sentence without listing all of the failings of the current bed. So this makes it a much clearer understanding for the reader in this situation. And these two assessment criteria, content and conciseness and clarity, are really the reason why I was looking at the case notes in that detail with the highlighted notes that are included, which really relate to the content criteria, and checking that the unhighlighted notes are correctly omitted, which relates to conciseness and clarity. So that's a good suggestion that you can do for yourself. Once you've written your letter, check what you included was everything that the reader needed to continue caring for this patient, and that anything that you've left out isn't necessary information that without which the reader would struggle to understand the patient's care. Genre and style is the next assessment descriptor, and this is checking whether you have written a letter which is clinical and factual and uses language which is appropriate for the doctor, for the document in this case. So this letter includes appropriate technical language for the reader, and we've just got one use of brackets here, which is appropriate but effective to separate that, to provide extra clarity for the reader without reducing the formality overall of this letter. And then we have organisation and layout. Now, in this letter, there aren't any specific dates which are needed, and this is a usual part of the clarity that comes from organisation and layout. But in this particular set of case notes, the dates aren't particularly needed to be included in the letter. But as previously discussed, there is a clear theme to each of the paragraphs, which makes this letter easy to follow and understand. And finally, language. As would be expected from an official sample answer from OET, the language features are all completely accurate. Additionally, language has been used flexibly through sentence type and tense use to clearly communicate the information to the reader. So let's look a little bit at some of the language and vocabulary that you should aim to be using in your own letters. And here I'm looking again at the vet sample answer. So what we can see from this letter is that there is a variety of sentence type that has been used. Here's an example of a complex sentence, a simple sentence, and a compound sentence. And this is natural to include a variety of sentence types in your writing because when we write, we combine information for the purpose of informing a reader of a situation. To do that, we will need to use a variety of sentence types. So you can expect to see examples of all of these in your letters. But if you have a look through your sample answer for your profession, you might notice that more of one type of sentence is used than another. That's fine. There's no kind of checklist to how many sentences that you would use, just that you are using an appropriate sentence type for the information that you're communicating. We can also see a variety of tenses that have been used to explain the situation, including present continuous, present perfect, present simple, as well as passive forms to prioritise here the infection above anything that the reader themselves did for the cat, as well as an active sentence which comes towards the end, which does put the writer at the front of the sentence to show their responsibility for this decision. All right, so let's just think about some next steps before I have a look at some of the letters that were submitted by candidates ahead of this session. So remember that sample answers are just one way to write the letter for this case note. So those of you whose letter was not quite the same or quite different, in fact, to the sample answer when you come to check your letter against the official sample letter, it doesn't matter if they're not identical, as long as you have evidenced the assessment criteria as well as the sample letter, then there are definitely more than one way to phrase and explain the situation. What I would say though is if you have missed out information or included information that isn't in the sample, then you might lose marks for content or conciseness and clarity, which I mentioned a little minute ago. And similarly, if the accuracy of your language and sentence construction isn't so good, then you will lose scores for language. But they may not be enough to overall reduce your score from the grade that you want, and these are definitely things that you can work on. It's also worth remembering that improvements and alternative sentence structures are possible in the sample answer. So as I was just saying, there is more than one way that you could phrase the information for this set of case notes. And certainly that's true even for the official sample answers. They're supposed to be a model answer. They're not supposed to be seen as something 100% perfect, perhaps. Now, I will come back to looking at some of the sample letters that have been provided by candidates ahead of this session. But I obviously, those of you who have also provided a letter perhaps for a different profession, I'm not going to be able to provide comments on all of those that have been received. Now, for our 10 professions that I've been covering today and last night, I can recommend one of our premium providers in particular, OET Online, because they are endorsed for many of these professions as well as medicine and nursing, which the majority of our premium providers are. So do have a look at the link which is on the page. There's a lot of benefit from getting feedback on your writing by someone who has been trained by OET, and any of the premium providers on our list have received that training, and we believe they can provide you with quality feedback as well as explaining your strengths and weaknesses and helping you to devise a study plan to improve on those weak areas. And one extra thing that you can do after this session is to review your letter. So once you've written your letter, review it against the sample answer, notice any similarities and differences between them, and look for whether anything that you've written is less clear, which you could improve having read the sample letter. Check your language and spelling to make sure it's accurate and so forth. But take some time to make some corrections and then rewrite your letter in perfect English. So when you come back to review and revise from it, you now have your own good example. Okay, so let's have a look at some of the letters that have been submitted. So the first one comes from Hafsa and is a dietetics letter. So this letter includes a clear purpose and the content that the reader would need to understand the outcome of the dietary assessment. There are a few improvements though that could be made to paragraphing. So for example, in paragraph 2, it's unclear whether there's 2 paragraphs within it because we've got this extra gap here, which isn't clear. Is this 1 paragraph or is this 2 paragraphs? So it would be good to make that clearer. And I also think that the last sentence in paragraph 3, let me just bring up my highlighter again, this paragraph would do better starting this paragraph. So breaking this up into what's going to happen next, that would make this a little bit clearer. The next letter comes from Joni and is an occupational therapy letter. So the information from the case notes has been grouped into useful paragraphs, but the purpose is a bit hidden. There's an unnecessary greeting at the end. It's very friendly, but there's no need to start off a letter with that sort of greeting, which is a little bit informal. And what it does do, as I mentioned, is it hides the main reason for writing. And it also gives the doctor extra detail to the background, which he would probably have been given by the hospital. So there is some unnecessary detail that has crept into this letter. The ending is also a bit misleading, as it's not the request as per the case notes. So the case notes is to request the doctor's support for the application for the new bed, but the ending of this letter suggests to update the wife when the bed will be coming, and that's misleading. That's not what it says in the case notes. This letter is from Virginia and is a radiography letter. So the reason for writing is very clear, and the information has been organised sensibly. Now, a key part to radiography letters is a need to sound neutral. So obviously somebody's complained and you feel justified behaving the way that you did, but the best way to cope with this is to be very neutral and factual. And there is a few phrases in this letter that could do with being a bit more neutral. So, for example, just saying to explain the events, regarding the delay, rather than my version would be better. And also changing the sentence starting under normal circumstances, which, as the head of radiography, they would know what type, how quick the process would be for the Mrs. Freeman's procedure. To something like, due to the patient's age, her x-ray required extra time, which avoids saying that the old lady, which isn't inaccurate, but it's not seen as a very neutral expression. There's also an inaccuracy about the pregnancy from the use of acknowledged. The case note says that the writer asked the patient whether they could be pregnant, and it was the patient that acknowledged that she might be. So there's a sort of misunderstanding there. I'm also going to cover a cover a couple of the other professions that were submitted in the last couple of days. Sarvin, I didn't give you the right feedback yesterday, so apologies for that. So although you make it clear in the second paragraph that the reader knows this patient, it would have made the purpose clearer to include this from the start. And it also, I think there could be some improvement on your structure here to put the dental content before the diabetes. So move paragraph 2 down to after paragraph 4, and that would help the doctor to understand why it was that you were writing to them. Another dental letter coming from Hayanthi. So you've included dates and measurements of the tooth number, for example, to help the reader understand the patient's condition. But similarly to the last letter, the structure of your letter could be clearer, and by acknowledging from the start that the reader knows this patient would allow you to omit details about his diabetes and medication, which would already be known. And finally, one other pharmacy letter came through from Jia Hui. So the second paragraph provides a reasonable summary of the situation, but the reason for writing is inaccurate, and there's no link to the Serapax being prescribed from the reader. So the reader would feel a little bit uncomfortable from this letter that that you fully understand the situation and their involvement in it. Some improvements to tense use, for example, despite being taken, which is in paragraph 2, would also increase the clarity of the letter. Thank you to everybody, though, that did submit a letter in advance. It's been great having the opportunity to look and review at some of those letters. So we're now coming to the end of the session, and I have 15 minutes to answer some of your questions. So what I'd like you to do, if you have a question for me, is when you go to the question box, please to type in your profession, which will help me to know which task you're talking about, and then your question, and I will try to answer a few of those in the next 15 minutes. So let's just come down to the end. All right, so if you've got a question, you're one of the professions that I've talked about tonight, do submit the question into the box. I'll just scroll back up to see if there were any coming in earlier on that I've missed. There are quite a lot of questions. Jessie, I think I covered your writing yesterday, so apologies if you missed that, but we will be making a recording of yesterday's session available on YouTube early next week. So Jessie, I remember your letter. I did provide a little bit of feedback to it, so do look out for the recording to see that. And that's true for anybody joining the session. We will be making a recording available from this session as well on YouTube next week, so you can have another look, have another listen. So Anjali, yes, apologies. I looked at pharmacy yesterday. So that recording will be available very soon. And please join that recording to have a look at pharmacy. Hafsa, as a dietitian, is it okay to write a long paragraph or to separate it in two would be better? Hafsa, it is fine to write long paragraphs. What I was saying with the paragraph in your letter was because there was sort of a gap between the end of one sentence and the start of another. I wasn't sure if you intended that to be read as a separate sentence, as a separate paragraph, sorry, or as one paragraph. So when there's one paragraph, we wouldn't leave a gap between sentences as there was in yours. So either add a line space to show that this is a new paragraph, or remove that gap. But length of paragraphs, absolutely, they can be long. Remembering that one paragraph will generally cover one topic. So if you're finding that you're covering a number of different areas, then it might be good to split it. But if it is just the one topic, then absolutely it's fine to have a longer paragraph. That seems to be all of the questions coming through from the healthcare professions that I've been talking to tonight. So what I might do, because there are a few other nursing and medicine questions coming through, I might answer some of those, but do jump in if you have a question and you are one of the professions that I spoke to tonight, and I'll come back to your question in a few minutes. So let's have a look at some of the questions that have come through from the other professions. So here's a question from Elizabeth, who is a nurse. I have a doubt regarding writing. If we are referring a known case either to a family GP or home care, how can we start the second paragraph? So Elizabeth, it's not something that I can answer without a set of case notes in front of me, because each situation is different. So even if you're writing with two sets of case notes to the patient's GP, because the actual situation that you're writing about is different, it will make a difference to what information goes into the second paragraph or not. So what I was saying this evening is you need to select the information, perhaps going through and deciding what information needs to be included, and then thinking about putting yourself in the reader's shoes. What information would they find most important, and prioritizing that. So you heard me say for the dentistry letters that I was just looking at, that some of the dental information would have been more helpful above the medication information. So put yourself in the reader's shoes, and that will help you to decide which order you should put the information. Aaron says, if I've already mentioned the specific request in the 4th or 5th paragraph, for example, to have home care, do I need to mention it again in the conclusion? No, not necessarily. Provided at the end of your letter, the reader has a very clear understanding of what is expected of them. So if you have put it in the paragraph before the final one, make sure that you're not sort of hiding that information and not leaving the reader with a clear sense of what is required of them at the end of the letter. Here's a question from a vet from Pearl. So for vet science, some of the letters has RE patient's info before the start of the letter. Would that be preferred, or is it better to incorporate the info into the paragraph? So our understanding, Pearl, is it is quite standard to include an RE line for vets as well as other healthcare professionals. It just enables the reader to get a very quick and clear understanding of which of their clients perhaps, or which animal in particular is being referenced before they start reading the rest of the letter. So you're not going to be penalised if you omit it, but we understand that it is good practice and may be useful for you once you do start working as a vet overseas. And we've got a question from Lice, which is speech pathology. So if the patient is 18 years old, should I use the first name, for example, Connor, or the last name, for example, Mr. Mills, during the writing? The advice that we give generally is a patient who is 17 years or older, you can treat them as an adult patient. So using Mr. Mills would be correct there. The only situation when you might not do that is if you've had a very long professional relationship with the patient, you might choose to address them by their first name to show your familiarity with them. But for most cases, as you see on the OET website, if the patient is an adult, then their first and family name is appropriate to use. Marianne is also a speech pathologist. I'd like to know if you write to another speech pathologist regarding a patient's dysphasia and the patient had a tracheostomy on admission, would it be necessary to include in your letter of referral? Potentially. Sorry, Marianne, it's difficult for me to get a good sense of that just from what you have included. I'm not sure about what you mean about a tracheostomy on admission. How does that relate to the other speech pathologist? Perhaps could you have another go at writing your question or explaining a little bit more? And I'll have another go at answering that question if you could just give me a little bit more detail. Let's have a look for a couple of other questions while Marianne is writing that. So Nashwa is saying, were the previous webinars recorded? Absolutely. So the nursing and medicine webinars are now available on the OET Facebook page as videos. The session that I did last night and the session tonight have also been recorded, and we'll be sharing them on the OET YouTube page next week, and we'll send out details about where you can find them. Hyanthi is mentioning about the letter that you submitted. So Hyanthi, I hope you heard the feedback that I provided about 10 minutes ago. I felt that there was some good content selection for your letter, but the structure could have been improved to make it clearer to the reader. So hopefully have a listen back and you can see on the screen my comments once the recording is available. Let's see, any other questions coming through? So here's one from Rostislav. Is it correct to write this sentence? He presented with a complaint of severe back pain associated with numbing in the left arm. Yes, it's fine to use the word associated if the two things are linked. Perhaps what I would say is with associated numbness in his left arm, rather than associated with in this case, and it should be numbness as a noun rather than numbing as a verb. But otherwise, yes, you can use the word associated for sure. Hyanthi says, does the heading of the letter should be DOB or do we make it the age? So the first choice should always be to include the patient's date of birth, because this is something, again, that the reader can check their records for. And it's a much more accurate measurement that they can check. If the date of birth isn't provided, then you can use the age, but there's no requirement for you to calculate the age of the patient unless it's given to you in the case notes. You're not expected to do any maths in OET. Kareth says, can we use different tenses in one paragraph? Absolutely. So often a paragraph will cover a topic rather than perhaps a particular time span. And so covering that topic, you might be showing developments of a situation, and you would use different tenses to do that. Ban says, if the occupation isn't mentioned, can we write patient after the age? Ban, sorry, I don't think I understand that question. I'll come back to that. Another question from Hyanthi. Many don't write the address of ours in the letter. Is it a must to write our address, or do we omit that? So the only address that you need to include in your letter is the one in the writing task. So there's no need to include the address of you as the writer. The only address that you need to include is the one from the writing task, and that's what you'll see in any of the official sample answers. All right, I think that brings us to the end of the questions. So thank you very much for joining me this evening. I hope there was something useful for everybody, even if I wasn't specifically covering your profession. Do look out for the recording next week. Oh, sorry, I will just pop back to Marianne's question. It has come through and I said I'd go back to it. So the patient had a tracheostomy on admission and received therapy during her stay in hospital. However, she is now ready for discharge. Will it be necessary to include that information? Who will continue with therapy? Marianne, thank you. That helps a lot. I would say that the other speech pathologists would want to know that a tracheostomy had been placed. If it's been removed, obviously it's less important than if it is still in place, but probably if there's still any after effect of the tracheostomy post-discharge, that would be relevant. I suppose that's what you need to check. Is the tracheostomy still having any impact on the patient now, in which case you probably will mention it. If not, you might mention it as a minor detail within your letter or omit it, but hopefully that helps. All right, now I really will finish the session. So thank you very much for joining me.